Welcome back to another video. If you already are a subscriber, thank you and welcome back again. If you're new here, welcome. I really truly do appreciate you being here. I am honored. Now, my name is Olive and I got diagnosed with PCOS and endometriosis a few months ago, then had surgery for it, recovered, okay? So part of what I do on this channel is to create videos that brings on an awareness on PCOS and endometriosis. If you probably are thinking, PC what? Endo what? That's probably like me a couple of months ago at my gynae's office, because I had little to no knowledge about these conditions. So I advise that you stay on so we learn together. Even if you do know somebody who has these conditions, or if you suffer from these conditions yourself, let's build a community, be a part of the community and let us grow together. Okay, I also upload content every single week on faith, health and beauty, so please hit that subscribe button and let's stay connected. Okay, now to today's video. So today I take you on my recovery journey post-op PCOS and endometriosis. So if you haven't watched my surgery video yet, I will strongly advise that you click on the link that is actually appearing on the screen now. Click on that link and watch that video first, then come back here and watch this video as a continuation from that one for it to all make sense. Okay, we good? All right, sweet. Now, so without taking any much more of your time, let's just get into the video. Hey guys, good morning. So it is post-op day 2. I'm feeling a bit better this morning, but last night I was in lots and lots of pain. I did go to bed earlier than usual, but this morning I'm a bit okay. I've still got those radiating pain, or those pain that's moving upwards towards my shoulders. I've still got those heat packs there on my stomach, and I am still using the heat pack from home that I just put in the microwave to heat up, and then I just rested on my stomach. And it's really painful when I cough, obviously because of the surgery that's happened. Having the heat pack here that I put over helps, because then I'm able to hold it against my stomach when I want to cough, but it's very painful when I do cough. So this morning I'm gonna go have some breakfast. I think I'm having some granola. I might have some scrambled eggs as well. But yeah, I'll see you guys in another video. I'll let you guys know how I go throughout the day today. Hey guys, so it's still day 2. I've had breakfast, I've had lunch, I've also had my medication. So I got sent home with Celebrex, Endone, and some Panadol. I have not taken the Endone yet because I haven't been in that much of a pain that I feel like will require me to take the Endone. So at the moment, I'm sticking with Celebrex and the Panadol, but I will take Endone if I do get, stronger pain, if I do start experiencing stronger pain, because obviously I'm at home, so I'm moving a lot more as opposed to being in hospital where I'll probably not move as much. I'm okay, but I'm very, very sore. I'm still doing dressings because obviously I do not want to put pressure on the surgical site. But yeah, my tummy feels really tender, really sore. I still have pain that's moving up towards my shoulder. So I've been using heat packs on and off on that. I'm just gonna sit for a minute. Wow. Yeah, I'm good. I'm okay. I just thought I'd come in here and just update you all, but hopefully I will see you guys in another video. But I'm okay. I just need to sit and rest, or lie down and rest and not move as much. I'm doing good. I'm doing okay. We'll see what happens before the night ends. If any of you have had surgery done for PCOS or endometriosis, please let me know in the comment below how you went, what you did for recovery, faster recovery. Any tips will be helpful. Hey guys, so Welcome back to another video. So today is post-op A4. So I'm feeling okay. Yesterday I did not record because I was obviously really tired and also very sore from the last recording that I did. You could tell how exhausted I was. So hubby pretty much just put me on a bed rest yesterday, so I had breakfast, lunch, dinner in bed. I think that paid off a lot because today I'm much more energetic. I feel really good. I feel really better. I feel very rested. So moral of the story is, when you've had a procedure done and you've been discharged and you're home, please rest. Your body needs it. Just move, slowly, just what your body can take. Don't push yourself too much, okay? Now, the medications that I'm on, obviously some of the side effects of it is constipation, so I have not been able to open my bowels. And post-op, it's very important that you actually do open up your bowels, have a bowel movement. So this morning I had a sachet of Movicol, which did help. So I've had a bowel movement. I'm still not in pain, just the discomfort and the soreness, and I wouldn't really classify it as pain, like excruciating pain or whatever. But yeah, so today I decided to get out of the house. We went to pick up my little girl from school, so I'm still wearing dresses, obviously, just so I'm not putting any pressure on the surgical site. Today I haven't got any heat pack on, so that just tells you that I'm getting better. And the pain that's coming up to my shoulders kind of lessened today actually, so it's not too bad. So yeah, I thought I'd jump on here and just give you guys a bit of an update. So day 4, and I feel really good. I feel way better than I did on day 2. If you've had this surgery before, let me know how long it took for you to actually have a bowel movement, okay? Because it's taken me 4 days, and I did have one today after having a Movicol. So let me know in the comment section below. All right, thanks guys. I will chat with you all later. It is post-op day 6 and I feel really good. I feel so energetic. As you can tell, I feel a lot more awake, a lot more alive. So medication wise, I have been sticking with my celecoxib and Panadol. I have not used my Endone at all. I haven't had a reason to use it. Had my pain been a bit more severe, then obviously I would have used the Endone, but so far just celecoxib and Panadol, and it's been great. Pain wise, I'm not in any pain. I feel really good about that. With the discomfort and the soreness, that's sort of all minimized now. I don't feel that discomfort or the soreness around my abdomen or my tummy area like I did a couple of days ago. And I'm actually starting to wear outfits other than dresses now. So like now I'm wearing just a simple tight and top, but it's definitely not pressing on my wound. So I've just got on a simple tight and it's not pressing on the surgical wound or anything. So I've got my surgical wound still there, and that's just like above it. I'm also not using the heat packs anymore because obviously I no longer have that radiating pain to my shoulders, not in my stomach area as well. So I'm not using heat packs anymore. Oh, and also guys, in regards to bleeding, I think it was on day 2 or day 1, I was saying that I was just using the liner because I was having very minimal blood loss. But at day 6 now, I'm currently using a pad because this morning I actually realized that the frequency is a lot more and the flow is also a lot more than it had been the last couple of days. So the last couple of days I've been on liners because obviously it's been so little. So let me know as well, when you had the procedure done, what was the frequency and the flow of your bleeding? Did you bleed at all? If you did, what was the frequency and the flow like? So I'm pretty excited about it all. Tomorrow will be day 7 and I also have my gynae appointment. So you need to stay on because I'll take you guys along with me to my gynae appointment, and I'll get to ask her some questions as well that I wanted to ask. I get to ask pre-surgery. So yeah, so that's it for me today. I was actually meant to start work as well tomorrow, but my mom, wanted me to have an extra week off because obviously I'm going to be on light duties and they're trying to sort out, what I can do and what I can't, or where I will be going and things like that. So I'm having an extra week off work, not complaining. So yeah, I will let you guys know tomorrow how I got the gynae appointment. I'll bring you guys along with me to the gynae appointment because that would conclude my 7-day journey pre and post surgery. Alrighty, so thank you guys for watching. Let me know how you were feeling on day 6 of your procedure. If you've had a procedure done for PCOS or endometriosis, let me know down in the comment below, okay? As you can see, I am well, I am okay, recovering okay, there is no pain, there is no soreness, there is no oozing on the one side, so everything is going really well. Today I have my appointment with my gynae, and in today's appointment I get to know exactly what happened in the theater room, what she was able to see, what she was able to take out, and where we're at currently. So I'm gonna go in there and I will let you guys know how we go. Obviously I cannot record while I'm in there having a chat with her, but once I come back out I will let you know what happened, okay? So see you guys in the next video.
How was your recovery?
Good. I'm
Yes.
recording my journey. Hey guys, so I've been in there. I've had a chat with my gynae. So everything went okay. So obviously in my hands are photos that were taken in theater, which does show the cysts and things that were removed, the endometriosis and all of those things. I will have a bit more in-depth talk about this when I get home. I just thought I'll let you guys know everything went okay, even though she just let me know in there that they did find out that one of my tubes were blocked, but again we will have more chat about this when we get home. But so far so good, everything is okay, and stay with me, and we will go through the photos together, what it means, what was taken out, what it looks like now, and where we're at now, okay? Going home.
Doors opening.
Thank you so much for watching that all the way through. So what we're going to do now is I'm going to go through the images with you, but before I do that, just so you have a bit more understanding, I will go through the procedures that were done in the OR or operating room. I've got with me here my operation record, so I'll be looking down a little bit or a fair bit because I've got to read out what's written on here and then explain it to you for it to all make sense, and then talk about the images because then it can all merge and fit in nicely, okay? So on here, the first thing I've got on here is an EUA. So she performed an examination under anesthetic. That is pretty much what an EUA stands for. It's an internal examination of the cervix, the vulva, the vagina, the anus, and EUA can also be used to check for signs of the spread of cancerous cells around the cervix. So yep, that was done. The next thing on here is a hysteroscopy and DNC. So hysteroscopy, but no, I did not take my womb out. What she pretty much did was to insert I'll just get something here just to show you. There we go. So the next thing she did here was a hysteroscopy and a DNC. So a hysteroscopy pretty much examines the inside of the womb. And how they do that is that they use a very narrow telescope, and at the end of it there's a light and there's also a camera, and it takes pictures of the womb and puts it on a monitor in the OR, and it allows the doctors to pretty much see what is going on in your womb. So I believe that's how I got some of my pictures here. So that was one that was done. The next thing that we did was a polypectomy. So the polypectomy was done to remove polyps. I did have some endometrial polyps, and endometrial polyps are usually non-cancerous growth of tissues or cells that are attached to the inner wall of the womb. And the main cause of this, as far as I know at this moment, is due to an overgrowth of cells that lines the inside of the uterus or the womb. Okay, now when you've got endometrial polyps, you can experience symptoms such as heavy bleeding, irregular menstruation. You can bleed also in between your periods. For me, what that looked like was that I was pretty much bleeding every single day of the month, but the frequency and the flow was a bit different, and I'll explain that to you. So during my cycle, my flow on my menstruation will be very heavy, very, very heavy. I can literally go through a pack of pad within a day. And it's also very heavy with like thick big clotting. And after my cycle, I straight away move on to clotting, to sporting. So I do have spots bleeding as well up until my next cycle. Sometimes the spot bleeding, and that's when I use the panty liners, and sometimes the spot bleeding can be a little bit heavier than just a spot, and that just continues on to my next cycle, and then I bleed again, and it continues on. So I was bleeding every single day of the month. So that's what it looks like. Now you can, if you still have endometrial polyps and you've reached menopause, you can also still experience menstruation or bleeding. So if you or anyone you know who has reached menopause but they're still bleeding, or they're still experiencing some form of blood loss, or just advise them, or advise you as well, to go and speak to your doctor or speak to your gynae, because that could be endometrial polyps that needs to be removed. Okay, awesome. So the next thing that we had done here was adhesiosis. So because I had some adhesions, so adhesions pretty much, or basically, they are organs that actually stick together, and sometimes they can stick together to the walls of the abdominal cavity or the pelvic cavity. And the organs that we're talking about here are the uterus, the fallopian tubes, and like the lower end of the what's it called? Mind blank. I'll do that part again. Adhesions are basically, so the next thing that we had done here, that I had done here, was adhesiosis. So I had adhesiosis done because I've got some adhesions, and what adhesions are pretty much are organs that actually stick together, and sometimes these will stick together on the walls of the abdominal cavity, or they will stick together on the walls of the pelvic cavity. Now the organs that we're talking about here, obviously your ovaries, your uterus, your fallopian tube, and also the lower part of your intestine. Okay, and they can all just get stuck to each other against the pelvic cavity. Now, how do you know if you've got some adhesions? When you're trying to have a bowel movement, it's not the most pleasant or the most comfortable, so if you're having difficulties, or it's a bit uncomfortable, or too much of constipation, and speak to your doctor about it, because there could be chances that you do have some adhesions happening there. And then another thing as well with adhesions is they also do collect peritoneal fluid. Now, that's fine, that's totally fine, but what the problem with that is, the sufferer, being us females, what happens is when the adhesions do soak up or collect that fluid, it actually causes us a lot of pain, like so much pain. All right, so that's why it's good to have them removed or get them separated. Adhesions also can affect your fertility, so if you're having symptoms here and there, please speak to your GP or your gynae. Someone who says about what triggers adhesions. So adhesions can be triggered from past surgery. So if you've had a procedure done in the past, and all of a sudden now you're starting to experience pain or discomfort when you're trying to open your bowels, speak to your GP or your gynae. Okay. Another thing is what that can cause adhesions is infection. So infection can cause that. And from research as well, one of the biggest players of adhesions is, you guessed it, endometriosis. So we had that separated as well. Another thing that I had done as well was laparoscopy. So laparoscopy is pretty much going in through my abdomen to operate, you know, more like a keyhole surgery kind of thing. But you did see the surgical site that I showed you when, so I had 3 post-op. I did show those to you, so that was laparoscopy done right there to go in. Or dye test, yeah. So after everything was said and done, she did go in with a special dye, flushed my fallopian tubes just to make sure they were all working okay. And that was when it was discovered that one of my tubes were blocked. But that's totally fine because you can have kids on just one tube working, so I'm not really bothered by that. But yeah, aside that, everything else is good. So I'll show you these now. Now this is a little bit graphic. If you did see a bit of a preview from the last video that you just came from watching, you thought, oh, I don't want to watch this, then you can skip it or just fast forward it a little bit, but I'll go through it quickly. So on here, you can see where they're trying to separate those adhesions right there. And I can also see some endometriosis there as well. And yeah, pretty much, you know, and some polyps as well. So that's the same thing with that as well. And I can see some endo there as well, you know. So this is pretty much what it all looked like, okay? Now, after surgery, I'll show you what it looks like now, all right? So this is what it looks like now. Very nice and very clean. You know, everything has been separated. You can see where they've, looks like she's, yeah. Anyway, I'll record that part again. Okay, and now, so this is what they look like now after surgery. Everything is now nice and clear. So that's what that looks like. I am happy with the results. I actually feel okay. So that's it for today, guys. Thank you so much for staying on this journey with me of pre and post-op. Obviously, there's so much content that I will be uploading around PCOS and endometriosis because there's so much to unpack and we have so much to discuss, okay? So if you still haven't subscribed yet, hit that subscribe button, hit the notification bell to be notified every single week when I do upload videos, okay? So until I see you again next time, please take care, be safe, and be kind.